Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without the way, let's get started.
An 85-year-old client is admitted to the emergency department at 8 p.m. with syncope, shortness of breath, and reported palpitations. Pulse is 150, blood pressure is 90/62, oxygen saturation is 92% on room air, and respiration is 22. Client has shortness of breath and states, "My heart is jumping out my chest, and it hurts some. I am having trouble catching my breath. I don't want to faint again." At 8:15 p.m., the nurse places a client on the ECG monitor and identifies the following rhythm. See the picture below. The nurse should do which of the following? Select all that apply. 1. Apply oxygen. 2. Prepare to defibrillate the client. 3. Monitor vital signs. 4. Have the client sign consent for cardioversion as prescribed. 5. Teach the client about warfarin, Coumadin, treatment, and the need for frequent blood testing. 6. Draw blood for a CBC count and thyroid function study. The correct answers are 1, 3, and 4. The client has atrial fibrillation and will have a regular pulse and will commonly be tachycardic, with rapid ventricular responses typically in the 110 to 140 range, but rarely over 150 to 170. The goal of treatment is the restoration of sinus rhythm. With a heart rate greater than 150 and symptoms such as shortness of breath, dizziness and syncope and chest pain, synchronized cardioversion will most likely be the treatment of choice. With more controlled heart rates and more minor signs and symptoms, chemical conversion with drugs such as cardizem and digoxin, prior to other interventions, such as synchronized cardioversion with appropriate anticoagulation, may be attempted. Because of the decreased cardiac output, monitoring is essential. Obtaining consent for cardioversion requires a prescription from a healthcare provider. But with the current heart rate, having cardioversion is a very strong possibility for this client. Defibrillation is used for ventricular fibrillation, not atrial fibrillation. Teaching the client about warfarin will be a possibility, but not an immediate intervention. Clients in continued atrial fibrillation usually require some form of anticoagulation. Drawing labs for CBCs to detect anemia or infection and thyroid function studies to determine thyrotoxicosis, a rare but not to be missed cause, especially in older adults. Serum electrolytes in blood, urea, nitrogen/creatinine, looking for electrolyte disturbances or renal failure, are commonly drawn for determining the cause of the atrial fibrillation, but they are not an immediate action. Which of the following clients is at greatest risk for Buerger's disease? 1. A 29-year-old male with a 14-year history of cigarette smoking. 2. A 38-year-old female who is taking birth control pills. 3. A 54-year-old female with adult-onset diabetes. 4. A 65-year-old male with atherosclerosis. The correct answer is 1. Buerger's disease is a non-atherosclerotic, inflammatory vaso-occlusive disorder. The disorder occurs predominantly in younger men, less than 40 years of age, and there is a very strong relationship with tobacco use. Diagnosis is based on age of onset, history of tobacco use, symptoms, and exclusion of diabetes mellitus. The primary goal for the client with Buerger's disease is to prevent 1. Embolus formation. 2. Fat embolus formation. 3. Thrombus formation. 4. Thrombophlebitis. The correct answer is 3. Because of the inflammation, a common complication of Buerger's disease is thrombus formation and potential occlusion of the vessel. Inflammation of the immediate and small arteries and veins is involved in the disease process. Embolus is a potential risk if a thrombus has developed. Fat embolus is associated with fractures of the bones. Thrombophlebitis occurs after thrombus formation. A client with Buerger's disease has established a goal to stop smoking. Which medication would be the most helpful in attaining this goal? 1. Bupropion. 2. Nicotine. 3. Nitroglycerin. 4. Ibuprofen. The correct answer is 1. Bupropion is used to promote smoking cessation. All types of nicotine should be avoided to prevent vasoconstriction. Nitroglycerin, used for angina, and ibuprofen, an anti-inflammatory medication, have no role in smoking cessation. A client is admitted to the hospital for evaluation of recurrent episodes of ventricular tachycardia, as observed on Holter monitoring. The client is scheduled for electrophysiologist studies the following morning. Which statement should the nurse include in a teaching plan for this client? 1. You will continue to take your medications until the morning of the test. 2. You might be sedated during the procedure and will not remember what has happened. 3. This test is a non-invasive method of determining the effectiveness of your medication regimen. 4. During the procedure, the doctor will insert a special wire to increase the heart rate and produce the irregular beats that cause your signs and symptoms. The correct answer is 4. The purpose of EPS is to study the heart's electrical system. During this invasive procedure, a special wire is introduced into the heart to produce dysrhythmia. To prepare for this procedure, the client should be NPO for 6 to 8 hours before the test, and all antidysrhythmics are held for at least 24 hours before the test in order to study the dysrhythmia without the influence of medications. Because the client's verbal responses to the rhythm changes are extremely important, sedation is avoided if possible. The client has had a below-the-knee amputation, secondary to arterial occlusive disease. The nurse is instructing the client in residual limb care, which of the following statements by the client indicates that the client understands how to implement the plan of care. 1. I should inspect the incision carefully when I change the dressing every other day. 2. I should wash the incision, dry it, and apply moisturizing lotion daily. 3. I should rewrap the stump as often as needed. 4. I should elevate the stump on pillows to decrease swelling. The correct answer is 3. The purpose of wrapping the residual limb is to shape the residual limb to accept a prosthesis and bear weight. The compression bandaging should be worn at all times for many weeks after surgery and should be reapplied as needed to keep it free of wrinkles and snug. The dressing should be changed daily to allow for inspection of the stump incision. No lotion should be applied to the stump unless specifically prescribed by the physician. The stump should not be elevated on pillows because this will contribute to the formation of flexion contractures. Contractures will prevent the client from wearing a prosthesis and ambulating. A client with Berger's disease smokes 2 packs of cigarettes a day. When helping a client change smoking behavior, it is important to know the client's 1. Ability to attend support groups. 2. Goals for the treatment. 3. Perception of the negative behavior. 4. Motivation. The correct answer is 3. When helping a client change detrimental health behavior, it is critical to learn how the client perceives a situation or problem. The client is more likely to change detrimental health behaviors if he realizes that there's a problem and that these behaviors lead to the problem. While understanding the client's ability to attend group meetings, his goals for treatment, and his motivation may help facilitate change, the nurse should first understand the client's perception of the problem and then determine what strategies might work from his perspective. The nurse is assessing a client with Berger's disease. The nurse should determine if the client is experiencing 1. Thickening of the intima and media of the artery. 2. Inflammation and fibrosis of arteries, veins, and nerves. 3. Vasospasm lasting several minutes. 4. Pain, pallor, and pulselessness. The correct answer is 2. Berger's disease is characterized by inflammation and fibrosis of arteries, veins, and nerves. White blood cells infiltrate the area and become fibrotic, which results in occlusion of the vessels. Signs and symptoms include slowly developing claudication, cyanosis, coldness, and pain at rest. Thickening of the intima and media of the artery is characteristic of atherosclerosis. Vasospasm lasting several minutes is characteristic of Raynaud's disease. Pain, pallor, and pulselessness are symptoms of acute occlusion of an artery by an embolus or other cause such as compartment syndrome. During physical assessment, the nurse should further assess the client for signs of atrial fibrillation when palpation of the radial pulse reveals 1. 2 regular beats followed by 1 irregular beat. 2. An irregular rhythm with pulse rate greater than 100. 3. Pulse rate below 60 beats per minute. 4. A weak, thready pulse. The correct answer is 2. Characteristics of atrial fibrillation include pulse rate greater than 100 beats per minute, totally irregular rhythm, and no definite P waves on the ECG. During assessment, the nurse is likely to note the irregular rate and should report it to the physician. A weak, thready pulse is characteristic of a client in shock. 2 regular beats followed by an irregular beat may indicate a premature ventricular contraction. The nurse is monitoring a client after and above the knee amputation and notes that blood has saturated through the distal part of the dressing. The nurse should immediately 1. Apply a tourniquet. 2. Assess vital signs. 3. Call the physician. 4. Elevate the surgical extremity with a large pillow. The correct answer is 2. The client should be evaluated for hemodynamic stability and extent of bleeding prior to calling the physician. Direct pressure can be used prior to applying a tourniquet if there is significant bleeding. To avoid flexion contractures, which can delay rehabilitation, elevation of the surgical limb is contraindicated.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.